Health officials are warning that the fight against malaria in Africa has reached a critical turning point, with drug resistance threatening recent progress. Partial resistance to some of the drugs have been confirmed or is suspected in at least 8 African countries, including regions in East Africa and some parts of the Horn of Africa.
According to the latest World Health Organization report, 2024 saw an estimated 282 million malaria cases globally and 610,000 deaths. About 95% of those deaths occurred in the African region, with children under 5 disproportionately affected. The backbone of malaria treatment across Africa, artemisinin-based combination therapies, face growing challenges. At a regional dialogue on malaria drug resistance in Africa, on the sidelines of the ICASA conference, scientists encouraged more efforts from government to protect the cure. Partial resistance to the drug has now been confirmed or suspected in at least 8 African countries.
And they have varied forms of the mutations, and they are gradually increasing. So the African leaders, I think, should take this as a very important issue and support their countries. Take ownership.
Ghana is yet to experience drug resistance in the treatment of malaria. Dr. Hilarious Abiu is the National Malaria Elimination Program Manager.
If we don't protect the medicines we are using now and we develop resistance, we are going to cough up multiple times the amount of money we are spending currently to treat malaria, just to make sure that our people recover when they get malaria. So it will require a lot of investment.
CSOs want government to focus more on preventive mechanisms.
Many countries who really have developed, they've invested in research, and I think Ghana government, apart from prevention, now we are calling them to invest in. They should also maybe invest in research.
Chairman of the Parliamentary Select Committee on Health and a member of the coalition of parliamentarians engaged to end malaria in Africa reaffirmed their commitment to efforts to eliminate malaria.
The fight to end malaria is not only a scientific issue. It is not only about the mutation of the malaria parasite. It is about how, as a society or as a country, can vote resources to fight against this malaria parasite.
Experts warn that if resistance continues to spread unchecked, Africa could see significant increases in treatment failures, putting millions at risk and jeopardizing decades of progress against malaria.